Trials are very important in moving forward leukemia treatment. So I've been a paediatric hematologist looking after kids with leukemia, looking after kids having a bone marrow transplant for about 20-25 years now. And during that time, then outcomes have improved. So if we go back to the 1960s, then all children with leukemia died, and if we come to the modern day, then almost all children with leukemia were cured. Not all, but almost all. And what's made the difference there is trials, actually. So until very recently, there were not new drugs, there were not new techniques, and so between 1960 and those next 30-40 years, there weren't new drugs, but results improved, and the results improved because of trials. So what trials were telling us was how to give the same drugs, but in a better way. And so the outcome and the improvement and the cure of kids' leukemia was down to trials. And nowadays and in the last years, there are new drugs, and there are lots of new drugs, but it is for trials to make us know how to use those drugs and to cure those kids that we currently don't cure. So we cure most kids, but we don't cure all kids. And the way we'll cure all kids is the way we've cured most kids, which is with a trial. So when people are giving money, as people do so generously towards leukemia research, then what I think is most important is that we have a research network so that what is known and what is discovered and the new treatments are available immediately to kids. So if I see a new drug or a new technique at a conference or at a meeting, actually I can't give it to the kids that I look after, because it needs a trial and it needs a trial network. Now someone's already developed that, so I don't need people or ask people to be giving money to research. What we need immediately for the children in our beds now is a network so that what is discovered, what is newly available, we can give quickly to kids. Now that's available for adults, and it's unfair that it's available to adults. And what's really important about Cure Leukemia in this campaign is that what is available for adults will become available to children. And for people giving money and for people raising money and their generosity and their activities, what that means for me is that we can apply the very latest treatments immediately to children in our care. So if we think they're good and they've been developed by other scientists or by drug companies or by other people, then if we think they're good, we can bring them to the kids in the UK and beyond immediately, because that requires trials.